Welcome to Med About You, your health solution. Vaginal discharge, what's normal and when to worry. Vaginal discharge is a completely natural and important function of the female reproductive system. However, understanding the difference between what's normal and what might signal a problem is crucial for maintaining good vaginal health. What is vaginal discharge? Vaginal discharge is a fluid produced by glands inside the vagina and cervix. It carries away dead cells and bacteria, helping to keep the vagina clean and prevent infection. The amount, color, and consistency of discharge can vary throughout a woman's menstrual cycle and life stages. Normal vaginal discharge. Normal discharge typically has the following characteristics. Color, clear, white, or off-white. Consistency, it can be thin and watery, thick and sticky, or stretchy like egg whites, depending on the time of the menstrual cycle. Odor, mild or odorless. Amount, varies, may increase during ovulation, sexual arousal, pregnancy, or while using birth control. Variations during the menstrual cycle. After menstruation, little to no discharge. Leading up to ovulation, clear, slippery, and stretchy discharge. After ovulation, thicker and white yellowish discharge. Before menstruation, slightly heavier and creamier discharge. Factors that affect normal discharge. Several factors can cause changes in vaginal discharge without indicating a problem. Hormonal changes, puberty, pregnancy, menopause. Sexual activity, birth control use, stress, dietary changes, medications, and especially antibiotics. When to be concerned about vaginal discharge. Certain changes in discharge may suggest an infection or other medical issues. Warning signs include abnormal color yellow, green, or gray may indicate infection, especially if accompanied by a foul smell. Brown or blood-tinged could be linked to irregular menstruation or, in rare cases, a sign of cervical or uterine cancer. Unusual consistency, very thick, cottage cheese-like, may indicate a yeast infection. Frothy or foamy discharge could be a sign of trichomoniasis, a sexually transmitted infection STI. Strong or foul odor, a fishy, unpleasant odor often points to bacterial vaginosis or other infections. Other symptoms. If vaginal discharge is accompanied by itching or burning, swelling or redness of the vulva, pain during urination or sex, pelvic pain, it's important to seek medical advice. Common conditions associated with abnormal discharge. 1. Bacterial vaginosis BV. Caused by an imbalance of normal vaginal bacteria. Symptoms: thin, grayish-white discharge with a strong fishy odor. 2. Yeast infection candidiasis. Caused by an overgrowth of yeast. Symptoms: thick, white, cottage cheese-like discharge, intense itching and redness. 3. Trichomoniasis. A sexually transmitted infection. Symptoms: frothy, greenish-yellow discharge with a strong odor, irritation and pain during urination. 4. Sexually transmitted infections STIs. Gonorrhea, chlamydia, and herpes can cause abnormal discharge and other symptoms. When to see a doctor. Seek medical care if you experience a sudden change in discharge color, odor, or amount, persistent itching, burning, or irritation, pain during sex or urination, bleeding not associated with periods. Symptoms that do not improve with over-the-counter treatments. How to maintain vaginal health. Practice good hygiene. Gently wash the vulva with warm water, no harsh soaps or douches. Wear breathable cotton underwear, helps prevent moisture buildup. Practice safe sex, use protection to reduce the risk of STIs, stay hydrated and eat a balanced diet. Avoid scented feminine products like sprays, powders, and deodorant tampons. Final thoughts. Vaginal discharge is a healthy and normal part of your reproductive system, but it's essential to be aware of your body's normal patterns. Subtle changes can be harmless, but significant shifts, especially when accompanied by discomfort or odor, should prompt a visit to your healthcare provider. Vitamins and nutrients for a healthy vagina. Vitamin D. Vitamin D supports the immune system and helps maintain a balanced vaginal microbiome, especially the growth of lactobacillus, the good bacteria. Vitamin C strengthens the immune system and promotes collagen production, which keeps vaginal tissues strong and elastic. It also helps maintain an acidic vaginal pH, preventing infections. Vitamin E acts as an antioxidant, protecting vaginal tissues from damage. It can also help reduce vaginal dryness, especially during menopause. B vitamins, especially B6, 9, and B12, B vitamins support hormone balance and nerve function, reducing risks of infections and promoting healthy vaginal tissue. Omega-3 fatty acids, not a vitamin, but essential for reducing inflammation and maintaining the moisture barrier of vaginal tissues. Probiotics, especially lactobacillus, they promote a healthy balance of vaginal bacteria, preventing infections like bacterial vaginosis and yeast infections. These foods can help keep your vagina healthy. Foods are especially helpful for maintaining vaginal health, supporting hydration, natural pH balance, hormone regulation, and good bacteria. Here's a detailed guide how and why these foods benefit vaginal health. 1. Probiotic-rich foods. Yogurt promote lactobacillus bacteria which protect against infections like bacterial vaginosis and yeast infections. 2. Vitamin C-rich fruits and veggies. Citrus fruits, bell peppers, kiwi, strawberries, broccoli. Boost immune function and support healthy vaginal tissues by maintaining collagen and proper pH levels. 3. Leafy greens. Spinach, kale, arugula, Swiss chard. Improve blood flow, reduce inflammation, and help regulate estrogen levels. 4. Omega-3 rich foods. Salmon, mackerel, sardines, flax seeds, chia seeds. Reduce inflammation, prevent vaginal dryness, and support hormone production. 5. Nuts and seeds. Almonds, walnuts, sunflower seeds, flax seeds, chia seeds. Provide vitamin E and healthy fats that keep tissues soft and moisturized. 6. Whole grains and legumes. Brown rice, oats, quinoa, lentils, chickpeas. Contain B vitamins which help regulate hormones and reduce PMS symptoms. 7. Hydrating foods. Cucumbers, watermelon, celery, zucchini. Keep vaginal tissues well lubricated and support detoxification. 8. Antioxidant-rich fruits, blueberries, pomegranate, grapes, raspberries. Protect against cellular damage and support immune health. 9. Garlic, natural antifungal and antibacterial properties help prevent infections. 10. Cranberries unsweetened. Help prevent urinary tract infections UTIs by stopping bacteria from sticking to the urinary tract walls. Final thoughts. Yes, what you eat has a powerful impact on your vaginal health. A diet rich in probiotics, antioxidants, vitamins, and healthy fats supports your body's natural defenses and maintains tissue health. Combine this with good hydration and hygiene for optimal results. Simple and effective ways to maintain vaginal hygiene. 1. Wash the vulva, not the vagina, with warm water. Do. Gently wash the external genital area vulva with plain warm water. Avoid using soaps inside the vagina, it disrupts the natural pH and good bacteria. 2. Wipe front to back. Prevents bacteria from the anus entering the vaginal area. Always wipe from front to back after using the toilet. 3. Wear breathable cotton underwear. Cotton allows air circulation and absorbs moisture. Avoid tight, synthetic fabrics which can trap heat and moisture, a breeding ground for bacteria. 4. Change out of wet clothes quickly. After working out or swimming, change into dry clothes as soon as possible. Moist environments can lead to yeast or bacterial infections. 5. Avoid douching. douching disrupts the natural vaginal flora and pH. It can lead to irritation, infections, and even increased risk of STIs. 6. Practice safe sex. Use condoms to prevent STIs and maintain a healthy pH. Pee after intercourse to help prevent urinary tract infections UTIs. 7. Stay hydrated. Water helps flush toxins and keeps vaginal tissues naturally lubricated. 8. Eat a balanced diet. Include probiotic foods like yogurt, leafy greens, and plenty of fruits. Avoid excessive sugar and processed foods, which can upset bacterial balance. 9. Menstrual hygiene tips. Change sanitary pads or tampons every 4 to 6 hours. Avoid scented pads or tampons, they may cause irritation. Menstrual cups should be emptied, washed, and sterilized properly. 10. Listen to your body. Discharge, slight odor, and mild changes are normal, but itching, burning, strong odor, or unusual color are signs you should see a doctor. Thanks for watching. For more informative videos, please visit our channel. Please like, share, and subscribe.